Hello again. I am Dr. Cameron Najat, the founder of Worldwide Endomarch. I would like to thank every single one of you, advocates, patients, friends of the patients, family of the patient, their society, their groups that you are helping to raise more and more awareness about endometriosis and helping that we end the dynasty of endometriosis. Endometriosis is a systemic whole body disease and it affects many millions of patients around the world. It has crippled, unfortunately, countless patients for years. We have addressed many of that, and due to collaboration between different disciplines, different groups, physicians, surgeons, scientists, sonographers, imaging technologies, acupuncturists, nutritionists, physical therapists, pain specialists, infertility specialists. We are making progress, hopefully, once and all to finish that. Your participation from everywhere around the world is appreciated. I see many of you have been around, you are participating on YouTube. Endomarch, please go ahead and sign in on the map and let us know where you are from. I see many people from Panama. I see people from California. I see people from Europe. I see many of you are still, I thought in Europe you are going to sleep, but still are some of you uh, awake, and I see your participation, and I thank you very much for being involved. So right now, the I see in the chat room some of you are sending us questions and or telling us where you are. Again, a lot of you, Panama is very appear to be in South America, very, very active. Of course, Team Mexico, I see that have been signed in. So before we proceed, I like to ask all of you that you are online and take a poll. I like to take a poll from you. And I appreciate it if you answer it. You can answer it with a yes or no. And the question is it or was it easy for you to find an endometriosis subspecialist in your region? Answer it yes or no. So question once again is, was it easy or is it easy to find an endometriosis subspecialist in your region? Yes or no? Please answer the question for us, and then I would show you the results. And you may see the results yourself on the screen. Let's see in a moment. They might bring it up for you, and it takes a little bit of time that we tabulate the answers to your question. So let's see if the answers are going to come or not in the group in the morning. We had almost a similar question, and the answers they were no. So, so it seems like informally the answer is that the majority of you have had no problem, had a lot of problem finding a physician in your area. So it seems like everybody who is just at least texting us and letting us know that are difficult to find subspecialists. So we see more participation of the many countries and many people. Like for example, I appreciate the participation of Sarah and Monique, and also Lisa Maria Arnold and or Emily Maloney. All of them, they say, oh, it is very difficult. So thank you, Hema. The same to you. So we will proceed to next. One of the other participants of EndoMarch, who has been very active and very productive in his community and has contributed a lot with the understanding and awareness about endometriosis in Venezuela, and is Dr. Karami. Dr. Karami has been uh, one of the major EndoMarch participants from its inception, and is on a daily basis very active in many ways, that he is able to help the patients in South America, in the whole region, and specifically in Venezuela. We thank him very much and we appreciate it for his advocacy. And hi, Dr. Kami, how are you doing?
Very good, Dr. Nizat. Very good. I'm so happy to see you. I'm so proud to be part of the EndoMarch for all of the project. Thank you, Dr. Nizat.
So you are more than welcome. Thank you for what you are doing for your advocacy. Tell us about the status of endometriosis, especially subspecialist treatment, awareness in Venezuela and the rest of the region of the South America that you can speak of.
Well, Dr. Nizat, we are no exception of all the world. We have the same big problem that we don't have that much specialists in our country. And this is when we get to Venezuela a few years ago, and we start with all this project of endometriosis. And thank you and your brothers, Zina and Farah, and you, Dr. Karen, that have been helping me so much to be getting all this project in my country. We start actually the first postgraduate course in endometriosis by the University of Zulia, actually is being the first one. And then we start also to a program training with my fellows. So I've been the 3 generational fellowship that been working with endometriosis and being given all this information in my country to get the diagnostic, the precoce diagnostic of the disease, and start treating this patient the right way. One of the problem that I get more concerned is when we get patients with endometriosis, we get in a very advanced advanced disease of the stage of the disease. And when we start working with this patient, it's not the same if you make the diagnosis at the beginning and you start from a virgin patient where you get the first surgery and you do the first treatment. So the prognosis in reproductive surgery and also infertility and pain is very different. So we've been working a lot of the awareness in this patient. So we're doing a big job here.
Well, I appreciate it. Thank you very much. And we all appreciate. What do you see? How do you think this issue of the lack of inadequacy, not being aware about endometriosis, not making progress the way we want for years, and where do you think the problem lies?
I think the problem is education. I think the problem is we need more training program with the doctors when they get out of the OB-GYN training. They get knowledge of the disease. It's very important that you think about endometriosis. This is the best thing that we have to get to the residents. Think and touch the patient and find the endometriosis. If you think about that, we'll diagnose the disease. A lot of these patients being from 7 to 10 years and jumping from one doctor to another doctor until you get to the right one. And that one is make the right question, make the right exam, touch the nodule, and say you have endometriosis, so you make the diagnosis. I think it's training, it's education, Dr. Nizat.
So do you think that in Venezuela, are there any efforts? We saw this morning, we had a lot of participants from different parts of the world, essentially, mainly it seems like in Europe, they are making significant contributions getting many people involved, like in Austria, in France, in England, and getting other disciplines of medicine, because endometriosis is not only a disease of reproductive organs, it's a whole body disease. Is it something like that happening in Venezuela or anywhere in South America that you are aware of?
Yes, Dr. Isaac. Actually, in my clinic, we have a complete team, gastroenterologist surgeon, urologist surgeon, general surgeon, psychologist, psychiatric, nutritional education. So we have a complete team that when we have the patient with endometriosis, we work, like you say, a systemic disease. We think in all the region that endometriosis can affect.
Well, we thank you very much again, Dr. Karami, for your involvement, for your advocacy, for helping the patient. And do you have any advice for your colleagues in your region in South America, how to get involved more, and what they, besides education that you mentioned, how to collaborate with each other to move the issue forward further?
Yes, I think the best thing is to be honest with the patient. If you don't know endometriosis, just give it to somebody that knows the disease and can make it treated from the beginning the right way. I think honesty is the best thing the doctor have to be ethic things, you know? And then is when we get more information, like you say, we have to talk about the disease. We need to talk about endometriosis. We need to make a program with like we get like joint between United States, Venezuela, and other countries will make like more patient education. I think this is the secret to the patient, listen to the patient and educate the patient. If you have pain, it's not normal. Look for somebody right to help you with that.
Thank you, Dr. Karami. Exactly in the issue of education and the training that Dr. Karami is mentioning, and we need more and more subspecialists, and we have had the pleasure of introducing to you today Dr. Zaghi, Dr. Carolina Chen, and now Dr. Corinne Hood are fellows that they are all trained OBGYNs, then learn to treat endometriosis. And we would like to hear from Corinne, our fellow now, to see how she sees the training and what is the difference between before she get here, before she learned, and how does she see the world differently comparing to before she started the fellowship.
Thank you for having me on, Dr. Manshot. So when I was looking for surgical training after residency, I knew that I wanted to expand that, especially in the realm of endometriosis. So when I found your program, I knew that I couldn't have training like this anywhere else, especially since you pioneered the field. And after being a part of the program, I found that that's definitely the case. And it's especially important to specialize in endometriosis subcare because it's so limited. We have patients coming in from all different parts of the country and even different parts of the world just to, have your expertise. So I think another part of your training that is especially important to me is utilizing a network of different care providers. The way that you emphasize working with pelvic floor physical therapists and fertility subspecialists, acupuncture, massage, just having a network of people to really help our patients.
Thank you, Dr. Hood. So tell us a little bit more about how, because you were trained in OBGYN in excellent program, and how did you look at endometriosis before, and when you came to the program, now how do you see endometriosis?
I've always had a lot of compassion for patients with endometriosis, just seeing the effects of it in my family and in the patients in my residency training. It just seemed in my residency training, we didn't have all the tools to be able to help these patients. So that's why I knew I wanted to come here and have that. So I appreciate you so much for teaching me to be able to do that because we definitely need more providers.
So thank you very much. But the issue is, it seemed like diagnosing endometriosis by itself. How did you, the patient that you were laparoscoping, did you see all the endometriosis that you see now, or would you see sometime a patient laparoscope tell her she is normal, and that now you say no, she is not normal? Do you see something like that?
Exactly. Yeah, unfortunately, that was the case sometimes. And working with you, it's been great being able to identify those lesions surgically. One of your famous quotes is, "What the mind doesn't know, the eyes can't see." So just being able to see it during surgery and be able to identify those endometriosis lesions, send them to pathology, and be able to prove that it's not in the patient's head, that what she's experiencing, we can actually prove it and be able to treat them.
So how do you think we should solve that issue, you and your colleagues, Dr. Chen and Dr. Zaghi, that you are the three fellows that you are doing this, and you are talking among yourself with a patient that they come here, you see so many infertility patients that they have no symptoms at all. Why don't you tell us about that? How many these people do they come and see us for pain, or do they come for other symptoms?
Yeah, we have several patients that come in. They've never experienced any symptoms of endometriosis in their life whatsoever, but they come in with infertility. So they seek treatment, have surgery, and we have a lot of great outcomes of patients, being able to conceive afterwards, and it's truly life-changing.
Well, we appreciate it very much, Dr. Hood, for your participation. I'd like to get now the participation of the country of Uruguay, and we proceed to their presentation.
Hi Endo Community, mi nombre es Lula, soy una de las cofundadoras de Endo Uruguay y en este video les vamos a explicar la situación de la enfermedad en nuestro país y por qué necesitamos la ayuda de todos ustedes.
Uruguay es un país muy pequeño de América del Sur, con solo poco más de 3 millones de habitantes y en el que la endometriosis es casi totalmente desconocida. La gente no sabe de su existencia, pero lo peor es que el sistema sanitario no tiene prácticamente conocimiento de ella y el Ministerio de Salud ni siquiera la reconoce como patología. Al ver que la enorme mayoría de la información certera de la enfermedad está en inglés, en marzo de 2020, Lula y Cami crearon Endo Uruguay, con el objetivo de servir de puente para las personas hispanohablantes que no manejan ese idioma. Ya de por sí es difícil navegar un diagnóstico de endo, creímos que el lenguaje y el acceso a la información no debía ser una barrera más que sortear. Por supuesto que en este contexto, en Uruguay no existe ninguna legislación que contemple a los pacientes con endometriosis. Pero en el Parlamento se encuentra en este momento un proyecto de ley al cual no adherimos como colectivo de pacientes por numerosas razones, pero la principal es que se centra únicamente en la fertilidad, ni siquiera define la enfermedad. Claro que esto no es de extrañar, ya que dicho proyecto fue redactado por una doctora especialista en fertilidad, sin ningún conocimiento de endometriosis y que es dueña de una clínica de fertilidad, por lo que consideramos un serio conflicto ético. Jamás vamos a permitir que se lucre con nuestra enfermedad y nuestro dolor. Visto esto y otras discrepancias que tenemos, como que no es inclusivo, no ofrece opciones de tratamiento actualizadas, ni pretende el acceso a la cirugía de excisión que todos necesitamos, Endo Uruguay como colectivo de pacientes decidió redactar su propio proyecto de ley. Nuestro proyecto no tiene bandera política ni intereses económicos, sino que se centra en lo que nos parece más importante, la calidad de vida de las personas con endometriosis. Buscamos ser inclusivos con todas las personas con endo, queremos que el personal de salud se actualice tanto en la patología como en políticas que eviten la violencia ginecológica, de género y cualquier tipo de discriminación. Buscamos que el acceso a los estudios de imagen especializados sea para todas las personas, sin importar el rincón del país donde vivan, que todos tengan acceso a los productos de gestión menstrual. Pero lo más importante de todo, buscamos que se forme a alguien en excisión, para que nadie más tenga que pasar por 5 o 7 cirugías que nada más brindan alivio, con suerte, por unos meses, para que ninguna otra persona tenga que sacar préstamos por años o vender sus autos y usar los ahorros de su vida para viajar al extranjero desesperada por encontrar alivio. Para todo esto, necesitamos la ayuda y el respaldo de toda la endocomunidad. Necesitamos que el Parlamento sepa que estamos unidos en esta lucha desde todo el mundo. Necesitamos que se sepa y se entienda las carencias y las dificultades que pasamos los pacientes con endometriosis de países con menos recursos, pero que somos igual de merecedores de la calidad de vida que buscamos todos. Porque la endo no distingue de raza, zona geográfica o idioma. La endo nos une a todos en esta lucha y esta lucha solo la podemos ganar si estamos todos juntos.
Thank you very much, Team Uruguay. We appreciate your advocacy and your help. Also, I see many of you are involved. You're getting on the line and you are getting on listening. Also, I'd like to give a shout out here to Team Colombia. Your time is coming up soon. And next, I would like to speak and present to you one of our former fellows who has been and is very vocal and very strong advocate of patient care and endometriosis patients. She is very active with Trinidad and Tobago, and she is originally from Trinidad and Tobago, and she is very active in promoting and helping the patients in that region of the world and internationally. Her name is Dr. Janelle Jacquemin, and I would like to welcome her and see what Janelle has been doing. She finished her fellowship 2 years ago, and she is again very active. And I appreciate her telling us what is she doing and how is she trying to help the patients in Trinidad and Tobago and other areas. Janelle?
Hi, Dr. Najat. Thank you for having me.
So tell us about your fellowship. What did you learn? What did you know before? How did it help you? And how is it helping you to provide justice and help to more patients in the United States and internationally?
So I learned quite a lot in my fellowship. I would be honest. I thought I knew a lot on endometriosis prior to doing your fellowship. But it was amazing to know the different ways endometriosis presents surgically. And likely, there's many opportunities where people may be missing the diagnosis of endometriosis because we simply just don't recognize the different ways it can look, both surgically as well as the characteristics that patients may present with. So I think that the fellowship was quite informative in opening my eyes to the wide array of endometriosis presentation, the right way that the patients present. And it actually helped me become a better doctor, a better surgeon in that regard. I learned how to thoroughly treat it using different modalities, including the laser, the robot, etc. And now I actually work in a fertility center. I'm the minimally invasive GYN surgeon at that center, where I'm able to operate on patients who present with endometriosis and other pathology. In terms of my country, Trinidad and Tobago, I have been able to help promote awareness with the Trinidad and Tobago Endometriosis Association. I act in the capacity of vice chair on the board. And with this, we've had many programs raising awareness. And we're actually trying now with the university, in collaboration with the university, we're trying to be able to have more education, not just for patients to be aware, but also for our medical professionals to be aware, to be able to recognize it, diagnose it, and treat it appropriately.
Wonderful, thank you. Now, I congratulate you for your good work and hard work. How do you think, after your fellowship and now, where do you think and how do you think we can standardize this care all across the globe and also democratize it to make sure everybody gets good care? How do you think we should do it?
I definitely think we have to start off getting into medical school, not teaching endometriosis just as an OBGYN topic, but across the board, because oftentimes patients present with thoracic, bowel, bladder endometriosis, and your average GYN is not capable of treating endometriosis in these locations. So getting a multidisciplinary approach starting as early in med school would be one of the key factors in treating endometriosis. Also, helping to like get rid of all these stigma and myths that we have in endometriosis. For example, I recently attended a seminar on endometriosis and the Black patient, because a lot of times we're often thinking that, endometriosis is not common in the patients of color, which is absolutely not true. So the patient of color tends to get a diagnosis of PID and not well treated for endometriosis, whereas, other patients will present and get treated earlier. So oftentimes we also have to kind of get rid of the stigmas and all the myths surrounding endometriosis to know that even teenagers can have severe endometriosis. It's not something that appears magically when we're in our 30s, 30 educated women, like all these stigmas and stereotypes we had before, and we know for sure are not true. We have to kind of destigmatize and get into not just the medical school, not just into our patients, as we say, but also on a governmental level worldwide, that we should recognize how severe endometriosis is, how debilitating it is for patients. I mean, the pain of endometriosis can be compared to as bad as, or worse sometimes than labor, but it's something that happens chronically. With labor, you have a finite time, you deliver the baby, you're done. Endometriosis is lifelong, especially for patients where we're not diagnosing it. So getting policies changed to recognize how debilitating endometriosis is, teaching from med school, go all the way up to residency, not just OBGYNs, but our urologists, our colorectal surgeons, our thoracic surgeons, making it a multidisciplinary approach, and then having policies that will support this, because as it stands now, there are very few and far few and in between specialists who really, really know how to treat endometriosis. And we need to increase that so that the treatment of endometriosis can reach not just patients who can afford to fly to the few specialists that it have, but it can reach to everyone, regardless of their socioeconomic background. So those are just some of the approaches that I think will greatly help our patients with endometriosis and help decrease the suffering that, patients experience.
Well, thank you very much for your very kind participation. I look forward to seeing you more and your good active advocacy. And thank you. And I would like to proceed now with more question and answer. And please answer this question, and you can go on your iPad and respond to me. And we can see it, and we take a poll from you. And that one of the questions that I would like to ask you is, those of you who are listening from around the globe, do you think you need to have a uterus to have endometriosis or not? So my question is having a uterus is a must for having endometriosis or not? Either answer yes or answer no. So the question is, do you have to have a uterus to have endometriosis, or you do not have to have a uterus and still you could have endometriosis? Please answer your questions. And I see here people are answering the question, and I would take a poll of the majority. For example, Stephanie said no, and I see here some other people that have said yes, but the majority of the people, they say no, you don't have to have a uterus to have endometriosis. Like Emma again said no, and Hema said yes. So we just have to, I let you give you a couple of moments to see the majority of the question is going to. So the question is, do you Does a patient have to have a uterus to have endometriosis, or that patient doesn't have to have a uterus to have endometriosis? So the answer is no. You don't have to have a uterus to have endometriosis. There are patients, we call them Rokitansky Kushner-Hauser syndrome, that there is no uterus at all, and still the patient has endometriosis. So presence of uterus is not a necessity for having endometriosis. You can have endometriosis without a uterus, and the majority of you are exactly, almost everybody is correct. You don't have to have a uterus. So another question that I have to ask you, and I want you to answer it, that do you have to have, or do you have to menstruate to have endometriosis or no? So the question is, is it necessary to menstruate and have endometriosis? Is it necessary? Can you have endometriosis without menstruating? The question, please answer it for us, and then we look at it. So is it necessary? Is it necessary to menstruate to have endometriosis or not? So please answer that question. Excellent. The majority of the people answering, almost everybody is correct. You do not have to menstruate to have endometriosis. You can have endometriosis without menstruating. So please stay with us. Again, after this presents some polls from and some presentation from Colombia, Peru, and Panama, I would get one of our other fellows, Dr. Chan. She is going to come in, and she is going to present and speak about an easy way to diagnose endometriosis in the rest of the world who cannot diagnose it. So let's proceed next with Colombia, after that Peru, and then Panama. And I welcome all of you. Thank you. Please go ahead.
Mi nombre es Luz Marina y soy la fundadora de la Asociación Colombiana de Endometriosis e Infertilidad. Desde hace 10 años trabajamos en educar, informar, generar conciencia y sensibilizar sobre la endometriosis, promoviendo a su vez políticas para el diagnóstico temprano. Todo comenzó cuando me diagnosticaron con endometriosis hace más de 22 años. Era muy joven, estaba entrando a la universidad y en esa época no había tanto acceso a la información, así que no conocía la endometriosis, ni siquiera había escuchado esa palabra. El médico simplemente me dijo que era una enfermedad crónica, que no tenía cura y que iba a tener dificultades para tener hijos de manera natural. Durante mucho tiempo me sometí a cirugías y tratamientos hormonales, muchos medicamentos y pastillas anticonceptivas para controlar los síntomas en búsqueda de esa calidad de vida que todos anhelamos. Después de casi 12 años del diagnóstico, quedé embarazada de manera natural y en contra de todos los pronósticos de los médicos, y por eso tengo esa iniciativa de crear una agrupación de mujeres que sufren de la endometriosis, no solamente para brindarles información, sino también para acompañarlas en sus procesos y brindarles el apoyo que necesitan. Es en ese momento que nace la Asociación Colombiana de Endometriosis e Infertilidad. Ya son 10 años de trabajo apoyando a mujeres, asesorándolas, acompañándolas en sus procesos a través de nuestro grupo de apoyo, de los convenios con diferentes especialistas a nivel nacional. Ellas pueden acceder a consulta, tratamiento, exámenes diagnóstico con descuentos especiales y tarifas preferenciales. Promovemos el abordaje integral porque sabemos que ese es el camino para tratar una enfermedad que es progresiva, que es recurrente y que además es incapacitante. Seguiremos comprometidos en la asociación con este trabajo, no solamente en pro del diagnóstico oportuno y de visibilizar la enfermedad, sino que también seguiremos trabajando en nuestro programa Salud Menstrual, que busca educar a niñas y jóvenes en todo lo relacionado con su salud y su higiene menstrual, además de derechos sexuales y reproductivos y empoderamiento femenino. Nuestro trabajo continúa y gracias por estos espacios para visibilizar lo que hacemos y así llegar a más mujeres para que nos contacten y poderlas apoyar.
Mi nombre es Andrea Ruiz y soy la Country Captain del Endoteam Perú. En estos 10 años, la Asociación de Pacientes con Endometriosis y Adenomiosis del Perú viene trabajando constantemente en seguir buscando medios para poder difundir, visualizar, concientizar y seguir educando acerca de nuestra patología. Estamos tendiendo puentes de comunicación entre los especialistas y los centros que manejan los protocolos adecuados para poder ayudar en el diagnóstico de las pacientes. Como asociación hemos apostado por el enfoque multidisciplinario, por lo cual no solo nos preocupamos en tener una lista de especialistas ginecólogos que manejen los casos de endometriosis de la manera correcta, sino que también estamos ampliando la base de datos a médicos de otras especialidades que también nos puedan ayudar a mejorar nuestra calidad de vida. Nos alegra mucho que los grupos de apoyo que manejamos sigan creciendo y eso también nos ha incentivado a poder crear una base de datos que nos permita tener datos reales acerca de la cantidad de pacientes diagnosticadas con nuestra enfermedad. Nuestra misión y nuestra visión siguen siendo la misma. El poder acceder a la salud es un derecho, más no un privilegio.
Mi nombre es Alejandra Loyola y soy co-capitana del Endoteam Perú. Este año estamos felices porque hemos logrado elaborar el proyecto de ley de endometriosis, un proyecto muy necesario para nosotras porque no es una enfermedad que es reconocida en nuestro sistema de salud y no es una enfermedad que tenga un enfoque multidisciplinario desde el punto de vista de salud integral, como sabemos que necesitamos nosotras como pacientes. En ese sentido, este año será el año de la lucha porque este proyecto se vuelva una realidad, se vuelva una ley y nosotras como asociación estamos felices, estamos muy encaminadas en que esto se haga realidad. Así que, sin más, este es el compromiso del Endoteam Perú para que el proyecto de endometriosis sea una realidad y vamos por eso.
Hola, mi nombre es Judith Sánchez y soy co-capitana del Endoteam Perú. Estoy muy feliz de pertenecer a este equipo, de poder apoyar, a concientizar, a viralizar esta enfermedad de la endometriosis. Sé que a lo largo de los 10 años de aniversario de Endomash Perú he podido ver que más chicas se siguen sumando, hay muchas personas nuevas en esta linda comunidad y es un trabajo conjuntamente con los médicos especialistas y las pacientes, el poder brindar charlas a través de los medios, de nuestras redes sociales. También estamos iniciando las actividades presenciales, de poder conocernos unas a otras, de ponernos a conocernos físicamente también. Y este Endomash yo sé que va a marcar un antes y un después, se van a venir muchas noticias más de nosotras, muchas sorpresas a lo largo de este año y que la comunidad siga creciendo cada año. Esos son mis deseos y mi anhelo.
Marzo es el mes de la endometriosis. ¿Sabes que somos alrededor de 200 millones de mujeres con endometriosis en el mundo y que afecta a aproximadamente a 1 de cada 10 mujeres? La falta de conocimiento de la enfermedad ha provocado un retraso en el diagnóstico en promedio de 10 años.
Y en Panamá educamos y creamos conciencia. Sé que es difícil, que a veces no te entienden. Pero yo he sentido lo que tú sientes. Somos el 10% de la población femenina en edad fértil.
Me dijeron que los cólicos eran normales.
Fui incomprendida en el colegio.
En el trabajo y hasta en mi familia. pero juntas somos más fuertes.
Tenemos un corazón amarillo que late contigo.
Y recuerda que no estás sola.
Porque AEMPA siempre levantará la voz por todas las endoguerreras de Panamá y el mundo. Dedicamos este video a todas las mujeres que han perdido la batalla.
Por todas estas mujeres valientes, siempre seguiremos caminando juntos.
We thank all of our friends and advocates from Colombia, Peru, and Panama for their excellent presentation and for advocacy. And thank you very much for all these years that you have been doing this. And thank you. There are many, many questions that you have sent, and I would try to address some of it. And also I try to address some of it with my colleague, Dr. Caroline Chen. There are many questions about how to diagnose endometriosis easily, if there is any way to at least have some idea about endometriosis without undergoing surgery. This is one question. One question is, do all the patients with endometriosis have pain? That's one question. Another question is, all the patients with endometriosis who do not get pregnant, do they have pain? So I'd like to address some of that with Caroline. Caroline, go ahead and address some of those questions. Yeah. Caroline is one of our fellows presently and works with us on a daily basis with these patients, and she has to address or answer these questions every day from our patients. Go ahead.
Thank you, Dr. Rashad. So, as we know, I think what we typically think of endometriosis, we always think of pain, but pain is not the only symptom that's affecting our patients with endometriosis. Oftentimes, patients are seeking help because they have what's called unexplained, or what has been determined to be unexplained infertility. But a lot of those times when you investigate a little further, it's related to endometriosis. Patients of Dr. Rashad are very lucky to have access to surgery. But what do you do when you don't have access to surgery or specialists that know to do the surgery proficiently? One way is, if you're not already aware, there is a Najat Endometriosis app that you can download on your phone. It asks a series of questions about your symptoms, about your past medical history, about your obstetrical history, that allows the application to give you a percentage of the chances that you may have endometriosis. That is going to be able to facilitate referral. You as a patient can seek out help. And then, or if you know somebody who is experiencing some of these symptoms, tell them about this application because it's a very useful tool.
Yes, this is what Dr. Chen is referring to. Our former fellows, Dr. Jackman and Dr. Agrawal, they presented abstracts about this at the American Society of Reproductive Medicine. This app is free worldwide through Endomarch. It has, based on some artificial intelligence evaluation of the questionnaires and algorithms, predicts your chance of having endometriosis if you have absolutely no symptoms and you are trying to get pregnant, all of your tests are negative, and you are not getting pregnant, this app could help you. Also, if you have a lot of pain and you don't have access to surgery and your imaging, ultrasound, MRI, others, and you don't have access to a physician, you see, and you are not getting pregnant, this app is completely free, and you can evaluate it. You can at least guide you to see if you have, and possibly you may have endometriosis or not. So there is another question that, do all the patients with endometriosis do not get pregnant? So Caroline, why don't you answer that question? Do all the patients who have endometriosis get pregnant or not? Or does endometriosis always cause infertility or not?
That's a great question, and it's a hard one to say. In life, there's very rarely a chance for always or never, but a lot of patients with infertility have endometriosis. A lot of patients who have endometriosis experience infertility. However, I don't want patients to feel hopeless or at a loss, because there are options to help them get pregnant in the future.
Exactly. There are many patients around the world that they think because they have children, but they have very severe pain with their period, without their period, all the time. Especially those pains are getting worse around the time of their menstruation, and they have already children. They have more than 1, 2, 3, sometimes 4 children, 5 children, but they have a lot of pain. And that could be endometriosis as well. Endometriosis does not always cause pain and does not always cause infertility. That is the enigma of endometriosis, that we call it a great masquerader. it behaves and shows itself in all kinds and forms. Sometimes, as I said, this is a whole inflammatory body disease. The inflammation could cause problems in certain areas. It is like a piece of sand in your eye or a rock in your shoe. If the sand is in your eye or the rock is in your shoe, it causes pain or problem. But if it is sitting in your pocket, you don't have pain at all. The same thing is endometriosis. If blocks or creates problem for the eggs or for the sperm or the embryo, it prevents you from getting pregnant, but you don't have any pain at all because it is not sitting on the nerve endings to cause the problem, the hormone production. That is why we will, hopefully, with more research, we will solve many of these issues. So we wanted to address this question that it was very commonly, it comes up, and they say, well, if they cause endometriosis, people who do not get pregnant and all of their tests are normal. Their partner's husband, their partner's tests are all normal. Their tests are normal. And they do not get pregnant. They call them unexplained infertility. And the doctor tells them, but we don't know what is wrong with you. And we are not getting pregnant. Okay, let's have IVF. They have IVF 1, 2, 3, 4, sometimes many, and they don't get pregnant. Never, unfortunately, comes to the mind of some of the patients or their physicians. In our experience, the majority of these patients have endometriosis. Caroline is doing a paper. Tell us more about what your findings are about the patient that they come to us with no pain at all. And they come, actually, the majority of the patients that I see are referred by very, very respected infertility specialists like Dr. Kelly Beck in Los Angeles, Dr. Sally Tazuki, Sunny June, and Amy Avazadeh in San Francisco, Dr. Court, Dr. Daniel Lane, and many other physicians. I don't want to miss anybody. That there are, everything has failed, and when we schedule, we evaluate them, they have endometriosis, and after treating the endometriosis properly, the good news is the chance of success is excellent, very good. Caroline, why don't you elaborate on that?
Yeah, so I think that, many of our Dr. Najat's patients are coming for unexplained infertility, as he has mentioned. And they, part of the infertility workup, some of these patients are getting testing with BCL6, as BCL6 is, when it's elevated, shows endometriosis. With what we're looking at is how does it compare with the Najat endometriosis app. The endometriosis app is actually able to screen very well. It's a very sensitive test for endometriosis, and it may help a lot more patients because it's just much more accessible than, say, something like an endometrial biopsy that requires a doctor's visit. It's a little bit more uncomfortable. It takes some more time it needs the equipment and the technique to be able to run and interpret those tests, as opposed to having an application that goes through your questions and your answers to be able to give you a less than 50% chance of having endometriosis versus 75 or 90% chance of having endometriosis. I think it's a useful tool.
Well, thank you very much, Caroline. Also, I'd like to thank many of you, like Hema, Shayla, Donna, many others that they are online and continuously trying to help everybody. So we are going to proceed with our colleagues and our advocates and our friends from Costa Rica, Then after that is going to be Mexico. And after Mexico is some more people from United States. And then some more videos from an advocacy group from Australia. Please tune in and enjoy the presentation, and we thank every one of them.
Jessica Calvo, soy la fundadora y presidenta de la Asociación Costarricense de Endometriosis. Somos una organización sin fines de lucro que trabajamos y apoyamos a las pacientes con endometriosis y adenomiosis para lograr un manejo integral y tener una mejor calidad de vida. El mejorar la condición de vida de estas mujeres a través de una adecuada información sobre la enfermedad, apoyándolas y creando conciencia en ellas, sus familiares, amigos, cuerpo médico y público en general sobre la condición de vida a la que se deben de enfrentar día a día. El brindar apoyo a las mujeres que sobrellevan esta enfermedad y a través de la comprensión de su sintomatología y los posibles tratamientos que se pueden lograr para así mejorar la calidad de vida de ellas y que puedan aprender a vivir con este padecimiento y aumentando su autoestima. El hacerlo del conocimiento de la sociedad en general y obtener derechos inherentes a la salud de las afectadas es nuestra gran misión.
Como miembro de la Junta Directiva y Vicepresidenta de AENDO-CR, ha sido todo un reto. Hemos trabajado fuertemente por capacitar, educar y empoderar a cada una de las pacientes. Hemos trabajado en mesas de diálogo. Hemos dado charlas, capacitaciones en diferentes lugares.
Como parte de la Junta Directiva ha sido un reto poder trabajar por todas aquellas pacientes del país. Le hemos brindado información a aquellas personas que lo necesitan. También hemos logrado que le den a más de 260,000 mujeres del país el medicamento llamado Dianogest. Hemos trabajado de la mano con la Caja Costarricense del Seguro Social y el Ministerio de Salud, obteniendo una excelente comunicación.
Yo soy la tesorera de la Asociación Costarricense de Endometriosis, AENDO-CR. En todo este tiempo que tenemos en las labores de tesorería, ha sido un reto muy fuerte porque nosotros somos encargados de recaudar los fondos para que la asociación pueda subsistir, pueda estar informando tanto a las pacientes, también a las personas ciudadanas acá en el país de nosotros en Costa Rica, que se informen de qué es la enfermedad, los síntomas, porque hay mucho desconocimiento. Y como ustedes pueden entender, la asociación es sin fines de lucro, entonces solamente contamos con la cuota simbólica que aportan las socias. Entonces esa es otra de nuestras misiones, que la asociación se dé a conocer más para así entonces poder tener más socias, tener más fondos para poder seguir con la concientización y la información de esta enfermedad que a veces dura hasta 7, 8 años que se la diagnostiquen.
Como miembro de la Junta Directiva de Vocal, he tenido el reto de apoyar en la presidencia en diferentes eventos de la asociación, en donde hemos realizado capacitaciones, donde hemos trabajado por darle a todo el país la información de la concientización y de la sensibilización de lo que es la enfermedad. Cómo trabajar en unión, la asociación con el gobierno y los pacientes. Debemos trabajar en unión para poder seguir logrando mejor la concientización y la voz para que las pacientes sean debidamente atendidas.
Este es el mes de marzo, mes de la endometriosis, mes que tenemos que hacer mucha conciencia sobre esta enfermedad tan crónica, desgastante, tan poco conocida, y creo que nos falta mucha conciencia a nosotros como doctores poder conocer más sobre todo lo que implica esta enfermedad. Hoy en día, afortunadamente, aquí en México ya tenemos maneras de tratarla, de abordarla de manera muy integral, de manera muy funcional, porque las mujeres con endometriosis van mucho más allá de tener una lesión, un quiste, un implante, una adherencia. Tienen muchas condiciones de por medio, de fondo, migrañas, depresión, ansiedad, problemas digestivos, problemas urinarios, problemas de infecciones, problemas inmunológicos, problemas hormonales, etc. Y son cosas que debemos de abordar hoy en día aquí en México, ya con mejores herramientas para poder ayudar y apoyar más a las mujeres con endometriosis.
Los tratamientos actuales van dirigidos en dos partes. El primero son los tratamientos médicos. La mayoría de los tratamientos médicos, la totalidad de los tratamientos médicos actualmente, lo que tratan de hacer es disminuir el nivel de estrógeno, bajando con eso la carga hormonal, el estímulo hormonal que, como platicábamos, estimula la endometriosis y estimula el endometrio. Existen diferentes formas de tratamiento. Las de primera línea son los anticonceptivos, los cuales lo que hacen es que estimulan de una forma muy pequeña, muy bajita el endometrio, haciendo que crezca poco y que haya poco sangrado, que haya poco crecimiento y poca estimulación. Otros de los tratamientos médicos de primera línea son los progestágenos. Los progestágenos es la hormona que se eleva principalmente durante el embarazo. Con esto simulamos que la paciente tiene un estado con un nivel alto de progesterona y bajo de estrógeno, lo cual hace que el endometrio, tanto como la endometriosis, entre en un estado de desidualización, que es crecimiento muy pequeño y se mantiene en pequeño. Y muchas de ellas dejan inclusive de tener periodos menstruales, como pasa en las mujeres embarazadas cuando la progesterona está elevada. Sin embargo, también tiene efectos secundarios parecidos a los de las pacientes embarazadas, a veces manchados transvaginales, retención de líquidos, inflamación en el pecho, cansancio, debilidad, a veces cuestiones sentimentales o cuestiones emocionales que pueden estarse afectando. Y de segunda línea encontramos ya los análogos de GnRH. Los análogos de GnRH son un medicamento que ya sea inyectados o en implante, lo que hacen es que bloquean desde el cerebro la producción de hormonas FSH, LH, que son las hormonas que se encargan de que el ovario produzca estrógeno. Al bloquearlos desde la parte central, los ovarios dejan de producir estrógeno y con eso la paciente deja de tener periodos, la endometriosis deja de estimularse y retenemos o detenemos el crecimiento y también los síntomas. Sin embargo, estos medicamentos pasaron a ser de segunda línea por los efectos secundarios que tienen a largo plazo y a corto plazo. A corto plazo, como bochornos, ansiedad, depresión, resequedad vaginal, resequedad piel, dolores musculares muy parecidos o iguales a los que tiene una paciente con menopausia. Y a largo plazo, estos medicamentos se ha visto que puede disminuir la calidad de hueso, afectar el corazón, afectar el cerebro. Por eso pasaron a ser de segunda línea y a disminuir su utilidad. Tratamientos quirúrgicos, los cuales de lo que se trata es que ya no importa si la paciente tiene estrógeno alto o bajo, porque ya no hay una enfermedad que esté estimulada por el estrógeno al quitarla quirúrgicamente. Para esto se necesita de médicos especializados, altamente entrenados en la resección de endometriosis de la forma más segura y completa posible.
El gran problema de la endometriosis en México es la falta de un diagnóstico temprano. y todo empieza con la normalización del dolor durante la menstruación en el entorno familiar. Los médicos en formación de ginecología y obstetricia, su formación más importante es la obstetricia durante los 2 primeros años. Los siguientes 2 años tienen que abarcar todas las especialidades que implica la ginecología, y eso es imposible para un tiempo tan corto. Y por supuesto, dentro de esto está la endometriosis. En nuestras instituciones no existe un diagnóstico temprano ni con resonancia magnética ni con ultrasonido. Se debe de tener un conocimiento profundo de la enfermedad y un radiólogo profundamente capacitado para poder tener un diagnóstico temprano. A la par de eso, debe de haber un programa de laparoscopía ginecológica en donde se puede llevar a cabo procedimientos de alta complejidad, lo que existe en escasos lugares de nuestro país.
To be here. It's so exciting to be on this 10-year anniversary of, the journey that you all started 10 years ago. Such a movement. Proud to be one of the founding members that, you guys recruited early on. So I just wanted to share, 10 years ago, the way I found the Worldwide Endo March was laying in bed in pain, feeling like I was all alone and no solutions. And I was actually on Pinterest, and I was making an endometriosis board because no one I knew had it. No one I knew anything about it. I felt just literally like I was on a deserted island. And as I made this board, I was just anything I could find online to help me with this disease, I was saving. And one morning I woke up and it said, Dr. Najat liked your post. And, I'm sure that, there's a mass army behind there, but someone liked it. And I'm like, wow, a doctor likes it. And I went Googling, and then I found information about the Worldwide Endo March. And I found all the great things that you guys were doing. And I think it was very early on in your mission. And so I reached out and was like, what can I do? I'm all hands on deck. I have to turn this adversity into fuel and help others. So from there on, I've just been partnered with you. I love everything that's been happening, but at some point I just branched off here in Delaware to try to impact change in a smaller capacity, within our own community. And so I founded the Yellow Cape, and so some of our work was just really just trying to make sure, while the doctors and scientists are trying to figure out how to help those with endometriosis, what can we do to make sure those that are fighting it aren't fighting it alone? What information can I use along my journey to help everyone? So, I found a lot of things, as far as information that's out there. There's so much in the community that's confusing, right? Do you get treated with a GnRH? Do you not get treated with it? If you don't go see these doctors that are on this, fancy list, are you going to be, treated properly or not? If your insurance doesn't cover it, what do you do? So I really just try to promote using what resources you actually have, access to, and what's within your reach, because not everyone can afford to put $10,000 down for a massive, excision surgery. We would love to, but unfortunately we're not there yet. So part of what I would like to do is I would love to challenge, Governor Carney, the governor of Delaware, and all the other governors and all the other politicians. We need to have access to affordable health care for endometriosis. We should not have to pay tens of thousands of dollars to get very much needed surgeries. We should not be viewed as just having a bad period. I just feel as if there should be more resources available to us. We should not be begging for the resources we need. And it's not just a bad period. It's not just not being able to get, the surgeries we need. It's not just being able to get pregnant. This is truly impacting our lives. We're not able to hold down careers. we're not able to be the partner that we need to be in our relationship, the parent we need to be in our relationship. So a lot of times I just really want to give a voice to the disease. I want to make sure that this is just viewed as a true medical crisis. It's not some little disease that we're just sort of being, drama queens, drama kings, any kind of drama around. It's truly impacting our lives. It's impacting the quality of our lives, our livelihoods, and it's impacting the capacity of who we could be as individuals. So anyway, I think that we need to really get some education into high schools, more so than what's out there. So if I were to look 10 years back, we're so far advanced because of organizations like the Worldwide Endomarch. You guys set the crusade out. There's so much awareness out there. But now we have so much awareness. We still need more, but also we just need access to the medical, capacity that we need. Like you said earlier, there's not just, every surgeon is not an expert in endometriosis. So we need to get the medical community united, and we need to just be able to have the access that we need without having to be millionaires to get it. We matter. Everyone matters. Every race, every gender, anyone that's battling endometriosis truly matters. So I just want to say, like, I love being part of this unity, coming back together with everyone that we started with, and we still have all hands on deck here in Delaware. We want to get across this line and continue to make strides, and anything that we can possibly do to just show that we matter and this disease impacts us, we're here for. So it's 2023 and no one should fight alone. Love Avi's message and everyone else's message. So agnostic from anything else that matters. If you battle endometriosis, you should not have to battle alone.
My name is Rhonda. I am president of Team Virginia, a founding member, as well as co-founder of Virginia Hope, a group that Judy and Shondalise and I put together. I have been suffering since about age 17, started with cysts on my ovaries, just lots and lots of pain. At the age of 21, I did have my very first surgery and was then diagnosed with endometriosis from there. And honestly, finding this group of women has really saved my life more than I can ever express, because this is the worst type of illness to have, and then to have no one believe you or understand just makes it that much harder. But I have had 10 surgeries to date. I did end up having to have a full hysterectomy in 2021. We did leave one ovary behind. Unfortunately, that was also causing issues. So December of that same year, I ended up having to get that ovary removed as well. And unfortunately, I'm still having pain, still struggling, but every day I'm still fighting, and it just helps that there's a group of women that can honestly say, you're okay, you can do this, you're not alone. And my main concern is making sure other women or, young ladies don't, get told that it's in their head, or that, it's just a bad period, or you'll be fine, have a baby, it's nothing. All of those things that we get told that are, very hurtful, and it kind of makes you feel even worse than you already do. So definitely still trying to get the word out. Our team actually in 2018 did get a delegate to make a proclamation that March is officially Endometriosis Awareness Month in Virginia. That was back in 2018. And then also, I believe Shandy and another one of our group members were able to go into a school and kind of start educating young ladies and getting the word out there about endometriosis.
I've had endo since I was 10 years old, and I knew it when I had it. but I didn't get diagnosed till I was like 15 or 16 years old. And in the early 80s, I found, an endometriosis support group, and that's what saved my life. I immediately could only find something that would tell me it's not in my head, I'm not crazy. But at that time, there was only one out there. The medical community told me if I got pregnant, it would stop the endo. So I had 5 miscarriages. And that in itself is heartbreaking for anyone. And then when I was 26 years old, they told me if I had a hysterectomy, it would stop the endometriosis. So after 2, tubal pregnancies and ruptured ovaries and cysts and more cysts in my uterus, I ended up having a hysterectomy, and it never stopped the endo. So now at age 62, I can say I'm a survivor, but it hasn't stopped the cramping and the pain. So I recently found out that I went to a couple doctors and said, I know the endo's gone because they've told me it's gone. And I recently found out that it's absolutely not gone, even at my age. It's still there. So even after all the surgical, interventions and all the prayers and the hopes and the encouragement, we are still not even close to finding a cure or how to stop it. And it's been on my gallbladder, it's been on my liver, I found a piece in my leg, in my eye, in my arm. It's just everywhere. And so what I want to say to the young people that are coming up now is please don't give up hope, because we really need you to fight this fight with us. There has got to be an end to this somehow, some way. But the only doctor that's ever given us any hope was Dr. Najat and you, Barbara. And we really appreciate everything you have done. And even the endometriosis specialists keep saying, you're fine, go on your way. It's gone. It's not gone after all these years. So what I want to say is don't give up hope, because hope has to happen for the younger generation to be able to get past this. And because I wasn't able to have children because of this hideous disease, I know that my lineage just has stopped, but I hope and pray that that's not the case for everyone else. And I really hope and pray that someday we'll find an end to this. And it's got to be because of people like you that just keep on and keep on going. And I know I'll never stop. Thank you.
So Dolores Gallegos from New Mexico, aka Team Doe for Endo. I'm right up there with Judy. I remember when I met Judy, I was like, okay, finally somebody who's had as many surgeries as I've had, and we're still here and we're still surviving after 20 some odd surgeries and 30 something years, So my biggest thing is for maybe saying that we're all warriors. I think I've always believed that endometriosis is a very individual disease, but the endo for us is what unites us together. For as long as I've been an advocate, I've met many people from around the world, been on phone calls overnight, not slept, talking to people, lost lots of endo sisters, and that's just to mainly suicide. And so to not speak in that regard, and that would be disregarding my friend Dana from New York. And I've always taken her picture for Endo March. I've always, so I say we're warriors because we're continuing the fight. We're survivors. And when we unite together, we're there for the fight. And so it won't be death to our warriors, it'll be death to endometriosis. So muerta a endometriosis.
Yes, thanks for having me. Yeah, I'm happy to be here for the 10-year anniversary. I started with you guys a long time ago. The way I actually found you guys was after I was diagnosed, was looking for a support group, literally, and came across your website. I've been working with the school districts here, and I actually think I may have endometriosis actually being taught in school systems here. So a few years ago, I actually started a podcast called Endo Talk, where I've actually got to speak to women from all over the world. And let me tell you, healthcare is no better than it is here. My thing is I want to say to the healthcare system is that endo is real. It's not period cramps. It's not just bloating. It's not just PMS. It's real. I was diagnosed 3 years ago with stage 4 endometriosis. I've had 8 surgeries in 4.5 years. And I've had a full hysterectomy. So, I can never have any more kids. I still fight every single day. It's caused a real strain on my marriage as I'm getting ready to go through a divorce because of my health issues. So my thing is I want women to know is they're not alone. We are your voice, and you also have an army of sisters who love you.
On the 4th of February 2013, Endometriosis Australia held their first board meeting. In 2016, the Worldwide Endo March had a country coordinator and event coordinators in Australia organising events in their local areas. Finally, in 2017, Australians received a national apology. On the 5th of December 2017, Health Minister Greg Hunt apologised on behalf of the government to those with endometriosis and committed to a national action plan for endometriosis.
We issued a national apology for failures of the past, but above all else, we're representing all of the women in Australia who have suffered in silence and whose time has come to be able to speak with confidence.
These patients are allowed to have their disease progress to horrific stages before anyone wants to step in, and so whilst surgery is an option, definitely down here we like to throw drugs at it, but again they're all band-aids. All they're doing is hiding your symptoms, they're not actually treating the root cause of the pain.
The Australian Government Department of Health released its first National Action Plan for Endometriosis in 2018, calling for greater awareness, education and research.
Today, I am delighted to announce and release the National Action Plan for Endometriosis. Every woman who needs help can seek help.
Endometriosis affects people regardless of sex or gender variation. It has been found in those assigned female and male at birth, including cisgender, transgender and non-binary individuals, as well as intersex people. The way we discuss and categorize this disease has real-life implications on access to care. Endometriosis must become its own specialty outside of gynecology with a multidisciplinary approach, combining specialists across fields of medicine such as urology, general, bowel, neurology, thoracic, and other areas of expertise. Otherwise, we are doing a major disservice to patients. The current RANZCOG endometriosis guidelines currently only include women, non-binary, and gender-diverse people. This needs to be updated, stating intersex people, cisgender men, and people assigned male at birth, and transgender men. Being lumped into the term gender diverse doesn't help any of these individuals feel supported or empowered to access endometriosis healthcare. In fact, it may be hindering their access. There is at least one male Australian endo patient whose diagnosis was discussed in a paper in 2019.
and he deserves radical inclusion in these guidelines. The best way to discuss demographics affected by endometriosis is to describe individuals as people or patients. These are general terms that include everyone impacted by this disease. Using specific terms like people assigned female at birth is appropriate when discussing topics that revolve around misogyny, growing up treated as a woman, or having experiences that relate to womanhood. Phrases like people born with a uterus are only useful for specific contexts relevant to the organ itself, like adenomyosis, pregnancy, or heavy periods. This phrase excludes some patients with endo, so it should only be used in the circumstances surrounding reproductive organs. In discussion of statistics, a good phrase is people assigned female at birth, where women has been used. Substituting the word woman here is actually more accurate. Endometriosis Australia received $1.1 million for their second research grant call-out in 2020. In 2021, the Royal Australian and New Zealand College of Obstetricians and Gynecologists published the Australian Clinical Guideline on the Diagnosis and Management of Endometriosis. As a response to the Australian Endometriosis Guideline, the Change the Guidelines movement began on social media and as a part of Endometriosis Awareness Month in 2022. The Australian Government published the 2023 Endometriosis Progress Report, allocating a total of $87 million towards endometriosis awareness, research and clinical care since the National Action Plan in 2018. The majority of funding will be going towards symptom management, with no further funds allocated to training Australian surgeons in expert interdisciplinary endometriosis excision.
We thank every one of you for your participation, for your selfless adhesion and advocacies in your region and globally for endometriosis, and for sharing your stories and giving your opinions about the solutions everywhere. We like also to inform all the viewers that these are all attempts to find help for everyone and prevent numerous surgeries, prevent expensive treatments, and finally find the foundation, the origin of the disease. We do like to let you know that millions of the patients around the world also receive proper care. They are having good results when are treated by knowledgeable surgeons and physicians who are specialists. We thank you for your participation. We have, if you go to www.endomarch, previous sessions for the past several years on endometriosis and diet, endometriosis surgery for infertility, endometriosis for bowel disease, endometriosis for genitourinary bladder ureter disease, endometriosis for lungs, experts that are respected nationally and internationally. They have expressed their opinion, and patients who have been involved, and many positive, successful stories in every aspect. The majority of the patients who have endometriosis, in our experience, respond very well when treated initially and early by an expert who knows how to manage the disease. In our experience, the majority of these patients being treated for infertility or pain, they do not require another surgery. So I do not want you to get any wrong idea and being helpless, and I do not want anybody to leave here being hopeless. That is completely different of the message we want to give. We want to thank you, and we would bring all examples for you to see there is a movement to really do fundamentally treatment, including or instead of simply addressing the disease by the old techniques that have been there for years and years. Excision of endometriosis is not new. Surgeons used to use their fingernails to claw endometriosis out, excising. They made large incisions. We have made significant progress of avoiding very, very large incisions all over the body to get to the disease. Now we can treat it properly, minimally invasively often, but not always. Surgery is not always the answer. We are trying to find solutions to even go further and make it everybody receives proper care. So please be, as it was mentioned by other presenters, we are collaborating with all of you around the world to move this forward. And to that note, I would like to invite our colleague, Dr. Tomoko Nakamura from Japan, and she would give us her opinion on what is the status in Japan. Nakamura, thank you very much for accepting the invitation. Thank you for participating in your advocacy. Tell us about Japan.
Good morning, Dr. Najat. It's a pleasure to be here, sir. Thank you so much. Are you able to hear me?
Yes, we hear you very well. So thank you for participating, Nakamura. Tell us how patients with endometriosis are doing in Japan. How is the care for them?
Mm-hmm. Okay, I think most Japanese people still feel awkward to get medical attention or even talk about their pain. And however, I think the awareness of endometriosis is gradually increasing. So some companies are starting to set menstrual leaves, but we still have we don't educate our children about endometriosis. So the only way we know about endometriosis is by paper, by journals. So I think this information for women here in Japan is still inadequate.
Well, thank you for sharing that. Mm-hmm. How do you think Japanese patients could be helped with further awareness because knowledge is power. Mm-hmm. Mm-hmm. How do you think the campaign, Japan is one of the most advanced countries in the world, very industrialized, but why and how do you think this inadequacy or unfairness towards the patient with endometriosis is? Why?
Okay. So in Japan, we have a very unique national insurance policy. So everyone has access to any kind of medication equally. So that's a good part. But the bad part is that we don't have any expert education specialized for professional endometriosis surgery. We have laparoscopy as a board certified subspecialty, but most of the board certified laparoscopists are are for oncology. So I think we need more laparoscopists that specialize, that have a lot of knowledge in endometriosis.
Thank you very much, Tomoko. And you have been yourself very a strong advocate for endometriosis care. I have been in Japan. I have seen you how you try to promote better healthcare for patients with endometriosis in Japan, in your university, with your professor, with the other colleagues of yours that are working with you. Do you think, is it cultural? Is it, how should this taboo, how should be this problem solved that even patients in your region get better help?
Yes, I think we need to have more information, and like groups like EndoMarch, where women can think that they have support and they can feel that they're not alone. This kind of groups should be more available in Japan, because I don't know any groups like this in Japan. So people more, I think, tend to keep it to themselves, and they silently just bear with it. So I think more women should talk about endometriosis and how they're suffering from it, and share their experiences, so that so other women can feel that they also have support. And additionally, as I talked before, I think we need more experts on this endometriosis. And like, as I did, I went to you to get more education about the endometriosis surgery, because it was not available that much in Japan. So I think we need more information and more educational system for endometriosis.
Well, we thank you. We know that, Dr. Nakamura, it is difficult sometimes, again, culturally, for some patients, because of the past thousands of years of hierarchies and cultures. And I have been in Japan before. I'm very respectful for the culture, and sometimes it is heartbreaking to see patients are suffering, but they are not speaking up. And I wish there was more people like you. I have trained other physicians from Japan, but it seems, and that is not alone there. That is an example. This is a very advanced, industrialized country, and patients are suffering. So imagine countries that they have far, far less means, and culture that they have far less means. And hopefully, as you say, more education, perhaps more social media, and with your help and your colleagues' help, I know many other physicians that they are very interested, and they are trying, and hopefully things would change even in your region. And I really thank you for your participation.
Thank you. Thank you so much, sir.
Yes, and we are looking forward to seeing you again sometime. Please give my best wishes to all of our colleagues and friends in your wonderful country. So,
thank you so much.
Of course, we proceed with some other participation of other participants. One of them is Beth Kovacs, and another one is from Holly Goodwin. Again, we intentionally included all of that. We should, and I have asked some of the other very happier participation also. Hopefully we'll have a chance they participate and give you some hope and positive aspect about endometriosis as well. Because there are many, many positive aspects that we can go forward with it. And now we proceed with Beth Kovacs and Holly Goodwin.
Hi everyone, welcome to the 10-year anniversary of the Worldwide Endo March. I am so honored to be here. The Endo March has given me so much opportunity, has been a beacon of hope for myself and so many others across the globe. We want you to know that we stand in solidarity together for health justice, equality, and endometriosis reform. My ultimate goal is to never stop because I plan on changing generational curses so our children and our children's children do not have to go through what we go through on a daily basis. I challenge every doctor to stop looking at us as a 10 or 15 minute appointment and start looking at us as a whole and get to the bottom of why we are coming to you in the first place. 7 to 10 years is not a good time for a diagnosis for any disease. We have then gone into a butterfly effect of from when we started to the end of that, and in the end, it is a worst case scenario for us, myself included. My pleas for help were denied for 9 whole years, and that lack of concern, that lack of education in the endometriosis world caused me to have permanent organ damage. I lost 22% left kidney function. I had to have my left ureter cut and reimplanted into a different part of my bladder. I also lost my ability to ever conceive a child again. That should have never happened to me, and it should have never happened to anybody else. So I am so honored to be a part of the Endo March so I can get the word out there that this does occur. And I also want to say that I did not have cookie cutter endometriosis symptoms, and that is why I was ignored for as long as I was. I just want you to know that we are here for you, and continue to be strong in your weakest moments. You're not alone. Thank you.
Hi, I'm Holly, and I live in Washington State. I experienced severe endometriosis symptoms for 35 of my 44 years until I received an expert excision surgery in September 2022. However, I had only been diagnosed 8 months prior to that. While 35 years may be longer than for many to receive a diagnosis, my story of medical gaslighting and indifference is all too unfortunately familiar for me and the other 200 million people suffering from endometriosis. My goals coming out of Endometriosis Awareness Month are to see, first, clinical standards for what constitutes an endometriosis specialist, updating continuing medical education hours which recognize the current and correct science regarding the disease, recognition of endometriosis as a disability on the Federal Job Accommodation Network, updated standards for endometriosis staging, and finally, increased awareness of adenomyosis. My observation has been that when many describe endometriosis, they are actually more describing the condition of adenomyosis, which is truly a uterine disease, and endometriosis is not a uterine or a reproductive disease. It's a systemic inflammatory disease. Also, of the 1 in 10 people that have endometriosis, up to 95% of these also have adenomyosis. Only recognizing endometriosis as a period disease, a uterine disease, or a reproductive disease is a detriment to both conditions. Thank you for your time.
Thank you very much, Beth and Holly, and previous advocates, every single one of you. Thank you very much again for your very eye-opening message. Hopefully people around the world listening and we do something about it. As I said, there are many positive aspects of when endometriosis is managed properly, good outcomes with early diagnosis, not waiting, for example, 30 years, 20 years. This is unfair, and disease is progressive. could get worse as it goes along, continuously gets worse and worse. So the earlier the diagnosis, the better for the younger children. And as Holly was mentioning, hopefully more education and early diagnosis for people. Now, we have another of our guests from India. We appreciate it. She is trying to be available, she's in the airport, but we'll try to see Dr. Ruma Sinha from India if she is able to see the status of what is going on. Thank you for being in the airport and trying to present. We will try, hopefully the internet would take it. If we didn't, then we will show your videotape. How is it? Thank you for your advocacy in India.
Thank you, Dr. Nazat. Truly honored to be part of this Endo March and the endometriosis advocacy group that you have created. Thank you very much for having me today.
It's a pleasure, and thank you for your good work to try to raise the awareness. How is it in India? How are Indian patients benefiting or not benefiting diagnosis? How long does it take? Are there enough experts in India to take care of the patients with endometriosis or not?
Thank you for the question. In India, I feel in the last 1 decade, we have improved the awareness of endometriosis. And we also believe that more and more patients are getting diagnosed because the awareness both in gynecologists and the regular population is increasing. We do have good centers and very experienced and very skilled surgeons now managing patients with endometriosis as subspecialists. So that's good for the Indian patients. However, I feel there is a need for more multidisciplinary, not just as a surgical team, but also the ancillary departments like physiotherapy, the psychologist, the people who can counsel. That kind of teamwork, I think, needs more improvement and awareness.
Well, again, we thank you for your advocacy, for trying to help the patient with endometriosis, and for your work. I know you are in the airport, so I don't want to keep you further, but
no problem.
Yes, and you are right. Endometriosis is a multidisciplinary disease, and there were some areas here when I see patients. There are some patients from India that have been in the area of, you had a Bhopal, was it correct? And I see when they have been exposed to environmental hazards, their endometriosis is worse. When they have been near toxic dumps, I see the endometriosis is far more severe on those groups of patients. What is your experience in India if you have any exposure to those patients that they have been in a poor environment?
I feel that because of increased exposure to endocrine disruptors, we probably are getting more and more higher incidence of endometriosis in patients. Also, this reflects the fact that younger patients are coming with very advanced disease, which we were not seeing 2 decades back. So it could just be a combination of more awareness to diagnose these conditions of patients with chronic pelvic pain, but it is definitely more and more younger patients coming with advanced disease, which requires diagnosis, attention, treatment, and a very long-term management. So I think it makes a difference, yes. I agree.
Well, thank you very much again for your participation. I wish you a safe journey. And then now we proceed with, again, some participation from Chelsea Hardesty, and then from Malaysia, and then from Singapore. Hang in there. These are very important. You see their stories, and at the end, I will further collaborate and also speak with you. Thank you. Now let's proceed.
Proud to see such a great turnout here today. It's fantastic to see so many people just gathered together and realizing that we need to take it just a step further. Truly a step further, because just as patients, it's been overwhelming. It's gone on way too long, and hearing these stories on support groups is just overwhelming. I myself has been diagnosed since 2018. I'm 29 years old. I've spent close to 20 years searching for an answer. They questioned colon cancer from Crohn's disease, and then told me to get my mind right and blamed allergies and IBS. I just always felt like something was wrong. And I think that's where it comes from. And that's where the majority of these endometriosis patients are truly getting their help, is because they just have that gut feeling that what they're being told just isn't right. And here we are in this day and age, luckily able to rely on social media where, you know, most of us here have probably gathered our information. I would not have gotten my diagnosis if it wasn't for Worldwide Endometriosis March and Extra Pelvic Not Rare and Nancy's Nook. And just, it wasn't just one organization. It wasn't just one social media activist. It was the fact that everybody's out here standing together and trying to reach a genuine population who is in need and who have been silenced for far too long. And I just want all of the patients to know that we are working so hard for you guys to be heard, because we know what it's like, and we deserve it, and you deserve it. Generations, like our children, sure as hell deserve it. So we are going to be making those waves, and I'm so thrilled that Barbie and Dr. Nazat and everybody has let me be a part of this. I started getting the better of endometriosis in 2018, immediately after I woke up from my diagnosis. What's funny about that diagnosis is at the beginning of October of 2018, I had a gynecologist agree to do the laparoscopy because, like, I felt, you know, I was like, hey, based on my research, I feel like it could be endometriosis. He was like, yeah, sure, let's get you in. 30 minutes, he looked at me and he says, you're clean as a whistle, sweetheart. Change your diet, worry about your stressors. I just felt like something was wrong. That same month, October, at the end of 2018, I found an endometriosis specialist, and she found endometriosis consuming my colon, rectum, and bladder. If I would have listened to that first doctor at the beginning of the month, I would probably still be suffering today. But I went with my gut, and I continued to push on with my research, and I am very thankful I did. You have that gut feeling for a reason, guys. Please follow it. Please follow it. I wouldn't be alive if it wasn't for my gut feeling and for every single one of you who are doing what we are trying to attempt today. So thank you, guys. For the patients in general, it's don't listen to them, listen to your body. Because 9 times out of 10, your body and the way you feel is correct. The fact that you're humbled over throwing up on the bathroom almost every day is not right. Those doctors aren't right. Just pursue it. Please don't give up. There's too many people who are giving up. Not to mention, we are relying on these doctors far too much, and we're given this medicine that is also setting us up for injuries and even deaths. And I'm just astonished at the amount of negligence that is surrounding this. So we are working hard, and that's just what I want everybody to know, is that we are working. We are trying to do something. We aren't just sitting here talking amongst ourselves. We are going, and we are going to be doing something. You guys will be heard. We are going to be your voice.
Anybody from all age groups, women from all race, all religion, all kind, they can have this illness. It's an illness that affects the mental, physical, and especially emotional.
I thought it was just period cramps. It's really painful, like unbearably painful for me, and it's been going on since I was 11.
Throughout my marriage, I had fertility issues, and I was not able to conceive until the 8th year of my marriage.
It's really frustrated, not just for 3-4 days, no, it's the 15 days. Yeah, 15 days. My period is the 15 days.
It started from period pain to period and ovulation pain to daily pain. During my studies, it was really hard because I couldn't focus. I was mainly tired, in pain, in heavy bleeding all the time.
When I told my friends I had endometriosis, they was like, what was that? And they were like, any other people also got period pain also, but it's not as bad as you. So they thought it was an excuse.
My mom was the one who told me that it was normal going through this pain. And she just told me, oh, it will be better after you get pregnant, because that's what she had last time too.
I keep getting questioned by my employers when I would take MC every month. Even some of the doctors, when I try to get the MC, they would question me, are you sure you're in pain? It doesn't seem like you are. Like, they don't give me the MC.
I suggest you to go and find advice or seek treatment. If advice from one doctor is not enough, please find second or third opinion.
You can just go to gynae every year or every 3 years just to check.
It's better to get it checked because, you know, health is everything, and your well-being, especially your mental health, is everything.
Listen to your body. Keep searching for an answer and keep looking for a solution. It's great to have a support system as well. Never give up.
Well, thank you very, very much. So it has been a marathon day. We have started very early in the morning in California, around 7:30. Right now is around 5 o'clock in California, in the San Francisco Bay Area. So the rest of you, in Japan and Malaysia and Singapore, Australia, they are about 15 hours, I assume, around that much ahead of us. So for them, it is already Sunday. So, and for Europe and Africa and Middle East, the rest of it, they are already late at night, and some people are already asleep. And in South America, they are almost some of them in the same time zone, sometimes 2 or 3 hours ahead. So you all have been fantastic. Thank you for your advocacy. All the groups, all the advocates, patients, their families, their groups. We are very happy to see every day more and more groups are birthing, coming to scene, and we collaborate with every one of you. Are, of course, welcome to Worldwide Endo March, your participation, and you are marching in your own, with your family, in your neighborhood, as a single, as a group. This is all what we want. The goal is to help find a cure and to prevent it, hopefully for the future generation, by the basic science research, and hopefully democratize and standardize the care in a very proper way by the future technology. And we personally, our group has been involved in that area. We are making in some areas some progress, but that is not enough. That's why we concentrated this year to see the problems associated with endometriosis, because we are hoping to have more progress. And since, as I said, in medical school, I see some changes, but I do like to see everlasting change. And each of you, your children, you train them, hopefully, that they do take the charge by going into research, by doing finding to really address that issue. If you address the issue of endometriosis, not only we have solved the problem for more than 400 million people around the world, according to our research, our paper published in, again, good journals, very important prestigious journal like Fertility and Sterility and Journal of Society of Laparoscopic Surgeons and Laparoscopic Surgeons, to see why endometriosis is so common, and we can help those groups of patients. Your children can solve it, and then other issues of cancer would be related, because endometriosis is not cancerous, but there is a higher risk of patients having cancer with endometriosis. So I don't want you to worry, but I want you to be aware. Knowledge is power, and it is step before cancer, cells their behavior. So the more we learn, we can solve it and open the door to help patients in other areas as well. And this is all because of collaboration of all the disciplines together. For the mental health, for health of all the organs of the body, and everybody is going to participate. And we thank you for what you are doing, and we look forward to more advocacy. I would end by having some small video of showing your participation for the past 10 years. Thank you again, and forward we go. We will continue with our Instagram, social media presentations and on a weekly basis addressing issues of endomarch and endometriosis. We encourage you, if you look at it under my name and under endomarch name in the social media, Instagram, YouTube, TikTok, etc., you can see some more information about endometriosis. Thank you again, and forward we go. Tune in for the video next.
Like a small boat on the ocean, sending big waves into motion. Like how a single word can make a heart open. I might only have one match, but I can make an explosion. And all those things I didn't say, wrecking balls inside my brain, I will scream out loud tonight. Can you hear my voice this time? This is my fight, so take back my life, so prove I'm alright, so my power's turned on. Starting right now, I'll be strong. I'll play my fight, so, and I don't really care if nobody else believes, 'cause I still got a lot of fight left in me. Losing friends and I'm chasing sleep. Everybody's worried about me. In too deep, say I'm in too deep. And it's been 2 years, I miss my home, but there's fire burning in my bones. Still believe, yeah, I still believe. And all those things I didn't say, wrecking balls inside my brain, I will scream out loud tonight. Can you hear my voice this time? This is my fight, so take back my life, so prove I'm alright, so my power's turned on. Starting right now, I'll be strong. I'll play my fight, so, and I don't really care if nobody else believes, 'cause I still got a lot of fight left in me. A lot of fight left in me. Like a small boat on the ocean, sending big waves into motion. Like how a single word can make a heart open. I might only have one match, make an explosion. This is my fight, so take back my life, so prove I'm alright, so my power's turned on. Starting right now, I'll be strong. I'll play my fight song, and I don't really care if nobody else believes, 'cause I still got a lot of fight left in me. Now I've still got a lot of fight left in me. Do you ever feel like a plastic bag drifting through the wind, wanting to start again? Do you ever feel so paper thin, like a house of cards, one blow from caving in? Do you ever feel already buried deep, 6 feet under screams but no one seems to hear within? Do you know that there's still a chance for you, 'cause there's a spark in you, you just gotta ignite the light and let it shine just on the night, like the 4th of July. Baby, you're a firework, come and show 'em what you're worth. Make 'em go as you shoot across the sky. Baby, you're a firework, come on, let your colors burst. Make 'em go you're gonna live 'em all in You don't have to feel like a wasted space. Your original cannot be replaced. If you only knew what the future holds, after a hurricane comes a rainbow. Maybe a reason why all the doors are closed, so you could open one that leads you to the perfect road. Like a lightning bolt, your heart will glow, and when it's time you'll know, you just gotta ignite the light and let it shine just on the night, like the 4th of July. 'Cause baby, you're a firework, come on, show 'em what you're worth. Make 'em go as you shoot across the sky. Baby, you're a firework, come on, let your colors burst. Make 'em go you're gonna live 'em all in Boom, 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 even brighter than the moon, moon, moon. It's always been inside of you, you, and now it's time to let it through. Boom, 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 even brighter than the moon, moon, moon. It's always been inside of you, 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 and now it's time to let it through. Baby, you're a firework, come on, show 'em what you're worth. Make 'em go as you shoot across the sky. Baby, you're a firework, come on, let your colors burst. Make 'em go you're gonna leave 'em all in me.